Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to focus on a pet peeve of mine, hypertension or high blood pressure. After all, May is Blood Pressure Awareness Month, so it's really a time that we need to use to focus on blood pressure. And for good reason, it's highly prevalent. I mean, it's pervasive, yet extremely common and quiet. So we need to really focus on blood pressure. It remains the number one risk factor for heart disease. No matter how you cut it, it's the number one risk factor. And it's also the number one risk factor for stroke, a major player in kidney failure. And also, it's been shown to have a major role in dementia, people that are hypertensive in middle age. So it's significant. Now, what is the incidence? Like it's between 75 million and 100 million. It keeps on increasing. A few years ago, it was like 55 million. It just keeps on increasing. And I think that's probably a reflection of poor lifestyle. But if you want more information, I can tell you that of everybody that has their first heart attack, 7 out of 10 are hypertensive. How about strokes? Well, 8 out of 10 people that are victims of stroke have hypertension. That's how common it is. So it may be quiet, but it's pervasive and it definitely will kill. So you'd have to know your numbers. I mean, we're talking about 1 in 3 people in this country having high blood pressure. So there's 2 aspects that I always talk about when I talk about hypertension. Number 1, knowledge. What are the numbers? Do you know your numbers? Number 2, action. What are you going to do to lower it? So I'm always asked this question, during presentation and talks, what is the ideal blood pressure? So I'm going to write it up here, 120/70. Hopefully you guys can read that. Now, I don't care if you're 20, 30, 50, 60, 80, or 100. That is still the ideal blood pressure, 120/70. That doesn't mean I treat people, I'd get everybody's blood pressure to that level. Of course I don't. I'd be giving people 2 and 3 medications and I'd treat them every 6 weeks. But it's what we focus on. It's still the ideal. And when I was a student, a gazillion years ago, 140/90 was borderline. Can you imagine? It was borderline. We didn't treat it. In fact, when I was a student and an intern, and even at the beginning of my residency, we didn't treat systolic, the top number. We just treated diastolic. We thought that was something that was of concern. But we learned in the 80s it's called the SHEP, SHEP study, which stood for systolic, hypertension, and the elderly population. I think they define elderly as greater than 55. Anyway, that if you followed these people for enough time, there actually was higher incidence of heart attacks and strokes in people with elevated systolic blood pressure, which is the top number, it was an important landmark study, because before then, again, when I was a student and resident, we were just treating the bottom number, the diastolic. We didn't really know the importance of the systolic. So they're both important. And again, so 120/70 is the ideal. 140/90 is considered high today. So what are the guidelines today? So the guidelines from 2017 said that anything above 130 for systolic or 80 for diastolic is considered abnormal. So let's say you're 131/81. You're hypertensive. That's all there is to it. That's not normal anymore. We actually like to be closer to 120/70. But anything over 130 for systolic, the top number, or 80 for the bottom number of the diastolic, is considered hypertensive. Now, other facts you might not know about with hypertension is that it's also been linked to dementia, certainly in people that develop it in middle age. Who wants that? And we think, well, what about young people? Young people are developing blood pressure hypertension as well. It's a serious problem. Why? Because people are fatter, overweight, and they're not doing anything. The youth of today is not a healthy bunch. But don't take my word for it. Look around. What do you see? So because people aren't really working out, they aren't exercising, they're eating junk food and highly processed foods, it sets the stage for hypertension. And again, you don't have to have any symptoms at all. It's still known to be the silent killer, and we all have to remember that. I like it when my patients have headaches or symptoms, because at least that's a warning signal, but most really don't have it. And many people, but at least probably, I would say over a third to half of people with hypertension don't even know it. And so many others are just inadequately treated. Why? because their doctors aren't as aggressive as I am in getting those numbers down. So they say, oh, 138 over 84, 140, it's okay, not too bad. It's not okay. It's not okay. It should be treated. So what exactly is blood pressure? I already alluded to the fact there's a top and bottom number. The top number is called systolic, and that happens when the heart actually pumps, when it contracts every beat. And then the diastolic, or the bottom number, is when it relaxes. So it's actually two phases of the cardiac cycle. Then we look at the epidemiology or the prevalence of the disease or the distribution. And I have to read these because I want to make sure I get the figures right. The prevalence is about 45.4% amongst adults. So most 50% of the population, right? It's higher among men than women, 51% versus 39.7%, but obviously affects both men and women. And get this, the age. In ages 18 to 39, its prevalence is 22.4%. That's almost a fourth of that age group. Okay, from 54 from 40 to 59 is 54.5%. And get this, from 60 and above, 74.5%. So it's clearly a disease of aging, but it can happen at any age. And like I said before, we're seeing it earlier and earlier because we're talking about a pretty unhealthy population. So what do we know? Also, one thing I try to mention is it is higher in African American population, not by leaps and bounds, but it clearly is higher in African Americans than in the Caucasians. So what do we know about hypertension? Well, I already mentioned one. It's clearly age related. There's a diurnal pattern to it. So usually blood pressure is highest in the morning when you awaken, because that's when our stress hormones are like going amok. There's the cortisol and the epinephrine and the norepinephrine. So it tends to be higher in the morning. As the day goes by, it usually tapers down, unless you've had a particularly stressful day, then it can be high. Exercise, it's usually, you get your best readings with exercise. And if you do your blood pressure about, let's say, 20 minutes after exercise, you'll see it's probably the lowest you would get in the entire day, because exercise relaxes the arteries. So it's a good thing. And 92% of people with hypertension, we call it essential hypertension. What does that mean? That means we don't really know what causes it. We know that it's hereditary. It tends to be a genetic thing. It runs in families. And we also, we know that for sure. But it's usually, there's not, and we know that it's got to be increased tone in the arteries that causes it, but we don't know what sets the stage. So it's called essential. There are a few, like I said, 8%. There are some structural reasons to have hypertension, but we won't go into that at this point. And the other thing to remember, it's no cure. It's not a curable situation. If you're hypertensive, you will always have that tendency, but it can be adequately treated. And that's what we're going to talk about next. I always like to go non-pharmacologic first, because that's what I stand for, right? I'm a holistic minded physician, and I always want to exhaust lifestyle before I go to drugs. So here's one of the things you might not be aware of: hydration. Hydration is so important. I think I've mentioned this in a earlier YouTube live presentation, but actually, we're talking about 75% of the American population is dehydrated, chronically dehydrated. So, that's very significant, because dehydration, your blood volume is contracted. Also, what happens, your hormones, your stress hormones come out, cortisol. This is not good. That itself will increase your blood pressure. Weight loss. Okay, this is easier said than done, but I have had people, if you can lose 10% of your current weight, let's say you're 200 pounds and you're overweight, 200 pounds and overweight, and you lose 20 to 10% of that, which would be 20 pounds over a period of time, you will drop your blood pressure at least 10 points. No question about it. So weight loss isn't really exhaustive, because doctors don't really go into that. But it's very important in controlling blood pressure: hydration and weight loss. Smoking cessation. We all know that nicotine and the chemicals in tobacco increase your blood pressure. No question about that. Alcohol. Definitely alcohol consumption is related to hypertension. So moderate drinking is to be preferred. Okay. Other one is, if you have sleep apnea, it should be corrected either with a CPAP appliance or with an oral appliance that brings your jaw forward, because uncontrolled sleep apnea can clearly be a cause or aggravating cause a factor for sleep apnea. In fact, for blood pressure. I had a patient years ago, and when I was a young cardiologist, and I could not get his blood pressure down. Of course, he was also overweight and didn't really eat the healthiest diet in the world. But I finally discovered that he had sleep apnea. We corrected sleep apnea, the blood pressure came down. Amazing. So don't forget that part. And then exercise. Exercise is one of my favorite things. There's no question that exercise can decrease your blood pressure. Multiple studies have shown that. It's one of those lifestyle therapies that I use all the time. And really, if you do regular exercise, you can decrease both systolic and diastolic blood pressures by as much as 10 points. It's pretty significant. That's as good as most medications, by the way. So what about resistance training? I'm a bodybuilder. I like resistance training. I like both, actually. But resistance training, thank goodness, is getting a lot more press now. In the old days, when I was studying exercise physiology, everything was about aerobics and cardio and really not much about resistance training. But now there's more and more information out there. And it's been shown that resistance training coupled with cardio or aerobics can actually give you a longer lasting effect on blood pressure control than just aerobics by itself. Very interesting. In fact, that's from a 2010 study, Journal of Strength and Conditioning. So by combining resistance training, you actually have a longer lasting effect on blood pressure, which is what we want. So no question about exercise. Then I like biofeedback. Now, biofeedback is really interesting. It's kind of like taking control of your body's physiologic function. Okay, like slowing your heart rate down, slowing your blood pressure, slowing your respiratory rate. And I used to do this when I was a runner many years ago, and I would wear this heart rate sensor and a monitor. And I would say, okay, I'm going to go up this very steep hill, but I'm not going to allow my blood pressure to go more than, or my heart rate rather, my heart rate to go greater than like 150. I'm just making that up right now. Now, for me to do that, I obviously had to slow my pace down because normally I would go up that big hill. I'd be running my ass, my butt off, and I would get to like heart rate of 170. So to control it, I used biofeedback. I mean, of course, I slowed my pace down, but I was able to get up that hill with less effort. And that's using your mind and your body together. There's a really interesting, I did some reading on biofeedback. This is this Respirate. It's RESP with a little E, RATE. Now, this is an interesting device. You can Google it and look it up. It's actually approved by the FDA. Can you imagine that? You know how conservative they are? And it's endorsed by the American Heart Association as the only tool that I know of that I came across in my research that can actually help lower blood pressure. So how does it work? It's kind of like it's a meditation kind of thing. You have a sensor, an abdominal sensor, strap into your upper abdomen, and you have like a little iPad. Actually, it's smaller than an iPad. And what it does, and then so they use a series of tones. And with the tones, there's also a certain breathing exercise you do. And so what they're working on is the exhalation, which I've talked about, which I will talk about in a future YouTube session. And they're really working on increasing your exhalation phase. So what does that do? That brings out your parasympathetic nervous system, or increases your vagal tone. We know that parasympathetic nervous system helps to relax your blood vessels. Hello, it's a great tool for lowering your blood pressure. So I'm really interested in this. It's about $380, I think, but it's something that, fortunately, I'm normal blood pressure, but something I would definitely consider because I want to do everything I can to avoid medication. So that's another great tool. So then we talk about diet. Okay, what's diet? Now, I could talk about low sodium forever, and that's always been controversial. And it still remains controversial because sodium is really essential for life. I don't make a big deal about it. Unless a patient, it's true that as you get older, and if you're African American, you tend to be more salt sensitive. But the average person out there with hypertension, it really isn't salt sensitive. So, placing a big deal on low salt diet, which is still what the Heart Association tells you to do, isn't going to amount to a hill of beans. Okay. So how do you know if you're salt sensitive? Well, give yourself a salt load and see what happens to your blood pressure. It's pretty easy, right? If you see your blood pressure going up 5 or 10 points, and by just having a high sodium meal, you're sodium sensitive. Everybody should know that. There's not a test for sodium sensitivity, but by keeping close attention to your blood pressure, you would obviously know that if you are salt sensitive. But I don't place restrictions like, I think the 300 milligrams of soda. I don't do that. I do with heart failure patients. I do if there's liver failure or kidney failure. I don't do it with routine hypertensive patients unless we know that they are salt sensitive. What I try to emphasize are the foods that I know are good with blood pressure. Most important is potassium. Okay, so potassium actually is another electrolyte. It's very useful in decreasing your blood pressure. So, what are potassium-rich foods? Fruits and vegetables. Okay, also potatoes. I'm not a big potato eater or lover because it's a starch, and I try to go low on carbs. But certainly, white potatoes and sweet potatoes are high in potassium. Yogurt is another one that gets high in potassium. But most of your berries, fruits, vegetables, spinach. I do not routinely give out potassium supplements and encourage them because I really think we can get enough potassium from our food. However, when it comes to magnesium, I generally do recommend magnesium. Why? Because about 67% of Americans are deficient in magnesium. And you can't tell by a regular blood test because most of the magnesium is in your bone and soft tissue. It's not in the bloodstream. So if your magnesium level is low on a routine blood test, that means you're scary low. It's really low. But magnesium, I often will give supplements. I take about 400 or 500 milligrams every night. It also is very good for sleep. It's very good for your heart too. But specifically, it's useful in decreasing your blood pressure. Um, those are the two major foods. Again, salt, I'm plus minus about. What about supplements? Okay, I'm high on supplements. I think without a doubt, coenzyme Q10, which is a cofactor, and we make it, but as we get older, we don't make enough of it. You need about 300 milligrams actually a day, and it can help decrease blood pressure. Fish oil. There's always a role for fish oil, at least when it comes to my practice. And there's two types. There's EPA and DHA. And don't ask me to tell you to pronounce the full name because it's too long and too difficult, and I wouldn't be able to do it. But DHA is actually most useful for the heart and the brain and vision. Those are three things we try to really want to control as we get older. But actually, it's been shown that DHA is more useful and its effect on blood pressure control when compared to EPA. So don't ignore that. And you can get DHA supplements as well. Another one that can be useful is hawthorn berry, which has been around forever. That requires about 500 milligrams and at least twice a day, sometimes 3 times a day to have an effect. But these are all supplements that can be useful. I have a supplement of my own called Pressure Wise for Heart Wise. And what it is, the major ingredient is olive leaf extract. Not olive oil, but olive leaf extract. And that's been shown in certain to actually decrease blood pressure. The big thing you need to know about olive leaf extract, if you're going to take it, you need to have a dose of about 1,000 milligrams a day. So my particular supplement, I had to make 3 capsules because it's a large dose. It also has quercetin in it and grapeseed extract. Those are the only 3 ingredients. It's a natural product, and that can be useful in lowering blood pressure as well. Keep in mind that supplements do not work in everybody. It may work in one person, but not in another. But it can be very useful, and it's something that should be at least tried when it comes to blood pressure control. The other thing that I want to mention briefly is earthing. Now, I was involved with Dr. Stephen Sinatra, the other integrative cardiologist. Actually, he's my mentor and teacher. Lovely guy. Anyway, earthing, we did a study. Earthing is basically using the electrons from the Earth's surface. It's either walking barefoot on the soil, walking barefoot on the sand, or using an earthing mat, sleeping on a sheet. And we showed with a small pilot study that I did with my faithful nurse, Angela Winter, and we showed that we were able to decrease blood pressure in people that did so many hours of earthing or being grounded a day by sleeping on a grounded sheet and by using a grounded mat when they were watching TV or when they were at a computer. And so it's also a wonderful tool. It's anti-inflammatory. It can help with sleep. Earthing is something that you should really look into. You can Google earthing. I think it's earthing. I forgot the site now. I think it's .net, but the big guy on earthing is Clint Ober, Ober. He's a wonderful guy. It's done extensive research. But basically what you're doing with earthing or being grounded is that you're using the electrons from the Earth's surface to squelch the free radicals. And free radicals happen with everything we do. Workout, shave, bathe, eat, sleep. Every activity you do generates free radicals. So what and those are positively charged particles. So if you have a negative charged particle like these electrons from the Earth's surface, they can help to squash those. So it's a really great anti-aging tool and also decreases inflammation. So that's earthing. Now, that said, we do have to use drugs lots of times. Not so much because we don't have a choice. We don't have a choice because people don't really adhere to the healthy lifestyle that I recommend. Um, I wish I could give you a figure of how many people we could save from pharmaceuticals if they really abided by the principles we've just mentioned. I'm sure it's pretty darn big, but as be that as it is, we have to get the blood pressure down. And I'll end with this. If you have questions on medications, I'll be glad to answer them in the Q&A section. I want to get to your questions on that. And there's a few medications that I do use, and I have to use them because I don't care. The bottom line is I got to get that blood pressure down. I don't want you to have a heart attack, a stroke, kidney failure, and I certainly don't want you to have dementia. So we have to get the blood pressure down, which means if I have to use drugs, I'll do it. It's not what I prefer to do first, but in a lot of my cases, I have to do it. People are way overweight. I mean, come on, the obesity rate in this country is 42%. The population of people that are overweight is 75% and getting fatter. So what choice do I have as a physician who's interested in natural remedies? So you do what you have to do. The bottom line is we must treat blood pressure. So with that in mind, I want to take your questions, and please bear with me because I broke my glasses today, so this screen is pretty small. Okay. Blood pressure genetic. It definitely runs in families. There's no question about it. It can skip generations. I don't know of a specific gene test. There probably is, because the genetics is flourishing right now. This whole genome, this development of the genome and whatnot. So there probably are specific genes for hypertension, but it clearly runs in families. So that's no question about that. What are the side effects of high blood pressure drugs? Oh boy. Okay, so there's a lot of side effects. I tend to use what's called ACE inhibitors or angiotensin receptor blockers, which are ARBs. Why? Because they're very well tolerated. They're generally just once a day, which is really nice, and they're effective. But they can cause dizziness. Okay, that's one of the biggest side effects. So I'm very careful about using those class of drugs in the elderly population. I don't want them to get dizzy and fall and break a hip. So that's one of any rash, diarrhea. I mean, and there's a very serious problem called intraneurotic edema, in which there's a strange effect, which the tongue and the mouth, the oral cavity, the lips become very, very swollen. And it can happen. I had it happen to a patient who was on an ACE inhibitor for several years, and all of a sudden he develops this angioedema. It's called angioedema, and it's an emergency. You have to get the emergency room and get on steroids right away because it can actually block your airway. That's very uncommon, but I have seen it in 2 or 3 cases. That's one of the, again, idiosyncratic effects of that medication. Beta blockers are useful in blood pressure. Not my first choice, but they can slow the heart rate down and they can cause fatigue. And nightmares. So, that's another class. The other one is calcium channel blockers. Those 3 classes that I use, and that they're famous for causing, it can cause headaches. But the big thing is edema, swelling. Who wants that? So, all these medications, which can be very effective, do have side effects. And sometimes it's like a trial and error I got to go through. Because this happens, and what can I do? I have to make combinations, or sometimes if you combine this drug with that drug in smaller doses, you'll have less side effects. But you have to be very patient in treating hypertension with drugs because you don't know what's going to work. In most cases, I can dial right in, but I would say about 20% or more have difficult time controlling because of the side effects. Okay, how big does the vagus nerve play? Thank you so much for that question. That was the whole thing behind the respirate is the vagus nerve. Because when you work on the breathing and you really slow down that exhalation, and like I said, I'm going to demonstrate this in a coming session. You're really playing on the vagus nerve. The vagus nerve is your Zen-like. That's your parasympathetic nervous system, and that definitely will help to decrease blood pressure. Whereas your sympathetic, fight or flight, right? I mean, that's the opposite. Yeah, if you're being chased by a saber-toothed tiger, you don't want to be Zen. You want to be tough. So, but there's a time for everything. And because of the world we're living in right now, I don't have to tell you how stressful it is with and without COVID. We are sympathetically overdriven. All of us are. So no wonder hypertension has gone from 75 to 100 million in just a few years, and it's rising. And I think that it's the interplay or the with the autonomic nervous system. So you've got the sympathetic and you've got the parasympathetic. We need more of the sympathetic, parasympathetic in most cases to control blood pressure. Great question. How big a role does salt play? Okay, I always get this one, and like I said, probably less than 50% of hypertensives are salt sensitive. Less than 50%. So again, to put everybody in a low salt diet is to me worthless and useless. So and again, we have to find out, are you sodium sensitive? Again, it's going to take, usually, and the older you get, the more salt sensitive you tend to be. No question, the African American population tends to be salt sensitive. I do not. I talk about medications. I try not to use diuretics as much as I can for treatment of hypertension. If it's African American, I probably will use it. And as someone who I know is salt sensitive, but I tend to avoid them like the plague because it depletes your potassium, which you already told you is useful in treating hypertension, and also gives you other electrolyte abnormalities and dehydration. That's all we need is dehydration when 75% of the population is dehydrated anyway. So, salt is plus minus. Now, if you go to a heart association, they're going to tell you it's important. They're going to put everybody on the DASH or the low salt diet. I don't do that. I have not found to be necessary or absolutely useful in my population. And I've been 35 years in practice, so that's my thing. But I think most functional medicine doctors like me feel the same, that salt has been really overplayed in the past. Okay, just thank you, Hillary. Okay, she wants to say hi. Okay, great to okay. The DASH diet, good for hypertension. The DASH diet is pretty conservative. I don't use it. In fact, in the book that I've written, that'll be coming out in a few weeks, finally. I don't even talk about it. Uh, I kind of put together my own diet plans and I analyze most diets, but again, it's based on the low salt, and no question, low salt may bring your blood pressure down initially, but what will it do in the long run? Again, if you're dehydrated, if you you need sodium. Sodium actually kind of volumizes your cells and your plasma. And if you deplete too much of it, you're going to get dehydrated, and then the stress hormones come on, and then you end up actually have a rise in blood pressure. So I don't do it, but a lot of people really like it because it's been around for a long time. Are over-the-counter meds, generally speaking. Now, do you mean, I don't know if you talk about meds or you mean, I guess you're talking supplements. No, supplements are good. I use them all the time. I told you the ones that I use, and I would always try supplements first. And I've had a lot of my patients do well with my pressure wise, which is the olive leaf extract. But again, it's an individual thing. With hypertension, I got to tell you, it's definitely trial and error, both on the part of the patient and the doctor. And I don't care what HMO you belong to or what corporate medicine is trying to do today, but not one size fits all. Not when it comes to diet, not when it comes to exercise, and not when it comes to medications, and certainly not when it comes to treating blood pressure. And I've been in this field for a long enough time to tell you that there's no way I can pigeonhole a plan for a patient because everybody's different. So I just try to exercise patience and be open-minded. Meds. Okay. Oh, okay. I was asking about meds, not supplements. No, the meds are useful. No question about it. Now, I don't know what you mean by over-the-counter meds. So I guess you mean non-prescription meds. I don't use them. I don't recommend. There is one that has been useful. It's called, gosh, a few of my patients like it. I can't. There is one over the counter, and it used to be based on a drug that was used many years ago called reserpine. It comes it's an alkaloid, Rafolio alkaloid. Anyway, it was a medication called reserpine, and it went out of favor when I was a student. I tell you how long ago that was. Had to be given multiple times a day, and also it could cause depression. So It's no longer being used today, but it isn't a particular product. And I'm sorry, I don't remember the name of the product now. It escapes me. I have a couple of patients on it, and they seem to enjoy it. Um, so, it's basically a supplement that fell out of favor as a pharmaceutical. So it's being used as a supplement at a probably lower dose. Good. Anything else? I think we got a lot of good stuff here tonight. So the bottom line, blood pressure is important. And I look forward to doing this every single May because it still is the number one risk factor for heart disease, and there's no getting around it. So, and to me, it's about employing lifestyle whenever I can. And, the people that I tend to attract are want to embrace that as well. So if there's no other questions, I guess we'll end. Okay. And we'll see you in 2 weeks. Now, in 2 weeks, for all you, well, not just women, this is all besides being High Blood Pressure Awareness Month, it's also Women's Health Month. Okay. So I want to devote some time. There'll be next session on women's health, and not just on hormones. We tend to talk a lot about hormones, but also on things like insulin resistance and things that while women get fatter as they get older, they don't like it, and what we can do about it besides hormones. So please join me in 2 weeks. And I thank you. I'm very grateful for you guys to be here tonight. Please subscribe and get other people to subscribe, because having subscribers is very important when you're coming out with a new book. And if you also check that like button, because that also helps my and comments. Please do give me comments and suggestions you have for future programs. I do read them. I send them a few weeks late in reading them, but I do read them. So that is very helpful to me to get those to that in the comment section. Thank you guys. And thank you so much. We'll see you in 2 weeks. Thank you.